We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships. While the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show, the focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Today.
And welcome to Doctors Are People Too. We're back, and it's actually back to school in Palm Beach County. So it's a very important day. And as you know, apple a day keeps the doctor away. So we have the apple here in the studio with the back to school. And I just want to introduce all the way from West Boca Raton. We have Dr. Narino Ocampo. She's come over to visit us on Doctors Are People Too. Dr. Ocampo, how are you doing today?
I'm fine, thank you.
Awesome, that's great. I wanted to have you on, obviously, today it's back to school, and I don't think we could have been any more timelier than having a pediatrician on the air to talk about, all that's going on this time of year. So thank you for coming aboard.
Thanks for having me.
Now, first thing I want to start with, we have, obviously, parents are our big-time listeners, so I doubt many of their children are driving around listening, but, they're probably in the car. And that's okay if you want to call in. We do have the pediatrician here for the next 30 minutes. It's 1-888-565-1470, and she's going to tell us all about what she does, areas of interest, and where her office is located. But first, I want to start out by, saying and asking you if there's anything you'd like to share with, students and parents at the start of this new school year.
Well, probably the best tried and true recommendations that we've heard from our parents and grandparents: make sure you get plenty of sleep, eat a healthy diet, try to eat breakfast every morning, make sure you exercise in between studying. Those are all very important. We need breakfast, especially to get the day started, calories to get the body going, and then trying to do after school sports just to keep our bodies healthy as well as our minds healthy.
You hit on the first thing I thought about was like breakfast. Like I miss it a lot as an adult, and it is so important to have a good healthy breakfast because that's like the fuel for the day, right?
It is. It absolutely is.
That's good to know. And now let me ask you. Let's for the listeners. Let's go a little bit about what age group you treat. When I hear general pediatrics, I'm not sure if I have it right. Is it, and you can answer this, is it newborn to question mark?
It can be from newborn to 18 years of age or till 21 years of age. That's really the personal choice of the pediatrician. I choose to see the kids in my practice until 21 years of age. The day they turn 22, they need to find an internist. So I like to see them through college.
And internist that's internal medicine?
Yes. And they can actually start seeing patients at 18 years old. If you go to a family doctor, a family practitioner, they can see children from birth through adulthood.
I had two great doctors growing up. I had a pediatrician, Dr. Stevens, and then Dr. Carr, both in Jupiter. So I think I stayed with Dr. Carr well into my 30s, actually. Now I have a doctor locally. But let's talk a little bit about general pediatrics. I know it's a very generalized term there, but it actually encompasses a lot of different areas of interest. So I saw that was your first areas of interest. So what is general pediatrics and what does a general pediatrician do?
Basically, we treat the entire patient. We start seeing children from the day they're born in the hospital, and we take care of the entire body. If something were to develop any type of a specific disease, we can initiate the workup to try to figure out what the disease is, and then we can send the child to the appropriate specialist to continue the workup and for full treatment. But we check everyone from head to toe, so we are pretty aware of everything that's going on in a child's body.
And then that also kind of encompasses adolescent health care. I'm sorry.
Yes, it does. It includes, it's from babies to children to adolescents, teenagers, young adults through the age of 21.
And I also seen on your areas of interest asthma, and it's something that I don't think we hear a lot in the news, but it's something that's very important because I know an asthma attack can really, it can be very dangerous. So, what are you doing for asthma? And let's just start there. What are you doing for asthma as a general pediatrician?
Well, basically, if a child comes in wheezing, we go ahead and treat them. We do specialized treatments with a nebulizer that gives them a medication to try to alleviate the asthma. And after a certain period of time, if a patient has recurrent wheezing episodes, then we determine that the child could have developed asthma. And there is a workup involved. We'll try to rule out allergies as a cause of asthma. Sometimes allergies are the cause. Sometimes it could be anything: cigarette smoke, humidity, cold weather, hot weather. So we try to find the cause for the asthma. And then the treatment is not only treating the actual wheezing episodes, but there is also preventive treatment, because we try to prevent the asthma from happening. Because every time there's a wheezing episode, eventually there's microscopic damage done to the lungs, and then that microscopic damage can build up, and then it becomes permanent damage, and you can actually lose lung function. So we don't want that to happen. So pediatricians are very well versed in treating asthma, and we really know how to take care of these children. And if it gets to be pretty severe, then we'll send them to our pediatric pulmonologist to help us with the management.
Now, the nebulizer, is that something that can be done in the office?
Yes,
office visit?
We can do a nebulizer treatment in the office. For older children who already have inhalers, if they need to come in, we can give them just an inhaler treatment and see how they do, or give them a nebulizer treatment if they're really struggling to breathe. And we can check oxygen levels in the office to see how they're doing and they're responding. And if the oxygen levels are too low and the nebulizer treatments are not helping, then we will have to send them to the emergency room for possible admission into the hospital.
Now, is asthma something, I'm very naive here, but though, is asthma something that can be seen on an X-ray, or?
You may find X-ray findings of inflammation in the airway, but that's really something that you pick up on physical exam. You can hear the child wheezing. We have them blow into a little meter called a peak flow meter to see how tight their lungs actually are. And if they can't reach a certain peak flow volume, then we know that they're tight and they need to have a breathing treatment. And the peak flow is determined by the height of the child. So depending on how tall you are, there's a specific range of numbers. And if we can't get them into that range, we'll give them breathing treatments. And then when they're healthy, we ask them to check their peak flows at home when they are in healthy states, so we can see what their true baseline is. So if they come in tight, and if they're breathing 150, blowing out 150 when they should be blowing out 300, then we know that they're really tight and we have to start opening up their airways.
I didn't know that, and I get listeners, that's why it's important to see an expert general pediatrician. I mean, there's a lot into the asthma diagnosis there. I got to go back into my days going to a pediatrician. Mm-hmm. I used to love it when Dr. Stevens hit my knee with the rubber mallet. So that's during the whole examination.
We still do that, and the kids just love it.
And the funny bone.
Yes.
Yeah. So that's during the asthma. You're looking for asthma and obviously other things during your the general workup there with
we are. And another form of asthma that we see a lot is something called exercise-induced or cough variant asthma. So sometimes kids will just develop a chronic cough, and that may be their only manifestation of asthma. They don't wheeze, but they're coughing constantly. And again, we will try to treat that. And if we see they respond to the treatments, then we put them on preventive medication. And if that calms it down, then we know that they have a cough variant asthma. A lot of children, when they exercise, they get winded very quickly. And if we see that happens frequently when they're running a lot with their sports, we'll have them take an inhaler 20 minutes before the onset of the activity. And then that medication calms down the airways, so to speak. And then they can pretty much get through their practice or their game without getting winded or short of breath. But some kids will still require a little bit more. They may still have to take preventive medication every day and then still take the inhaler just before the game to really try to prevent the wheezing or bronchospasm episode to occur.
And that also makes me think to a story back in my younger days. I had a friend, and she had asthma and an inhaler, and there's a couple of times where she, had to use it, but she actually taught me Lean on Me on the piano, so I always remember that. So, So the inhaler, is that something that can be prescribed by the general pediatrician?
Oh, yes.
Okay.
We all can take care of asthma in town. We can prescribe the inhalers. We follow up with the children afterwards to make sure that they're using it correctly, and we talk to the parents if they're using their inhalers too much, and if they have to go through more than one inhaler per year, then their asthma is not really that well controlled, and then we will have to start them on preventive therapy so that they don't need to keep using their inhaler that much.
Now, when you're doing the general workup, also, I know you're talking to the patient, keeping them calm, obviously, with your personality, and that's important. But you're also listening to the heart and other the areas of the body with the stethoscope.
Yes, so we listen to the heart and lungs with the stethoscope, and we use the otoscope to look in the ears, shine a light in their mouth, to look at their throats. The ophthalmoscope is to look at their eyes. We lay them down. We check their abdomens, check their backs for scoliosis. So it's a pretty involved exam from head to toe.
One more question about general pediatrics, and then I'm going to ask you to share with the listeners where your office is located. But I want to ask you before I forget, allergies, is that something that also you're looking for during a general workup?
Yes, allergies seem to be going up in this country in our children as asthma has been rising also, and lots of times they do go hand in hand. And when we do an asthma workup, we will try to see if it's an allergen in the environment that's causing or triggering an asthma episode. So we're so lucky now, we have blood tests available that can test for all the different indoor and outdoor allergens by region in the United States. So we're in South Florida, we're considered region 4, so we can do an allergy workup, order the blood test, patient goes to the lab, gets their blood drawn, and we get the results within a few days, and then we can see if they're allergic to trees or grass or pollens, the outdoor allergens, molds. The indoor allergens are your dog and cat. Dust mites is a big one. Cockroach, even mold indoors. If you have a leak and there's mold behind your walls, most of the time you can't smell it. You'd think you would, but you really can't. So we have this available now to help us. And then still, if anything turns up positive, or even if the allergy test comes back all negative, no allergen shows up, I would still send the child to the allergist because the skin test is still the gold standard. But at least the blood test is a nice screening test. For example, if I see a child is allergic to dust mites and they're wheezing and they've been having asthma episodes, we have them do dust mite control at home. I give them a handout, tell them how to try to get rid of the dust mites and keep them under control. And most of the time, their wheezing and coughing starts to go down, or they may just be chronically congested. And we start to see, as you get the dust mites under control, their symptoms start to subside. And then after a year, we'll check again. And if they've done really good dust mite control at home, you can see the allergy levels go from 4, 5, or 6 being the highest, down to 0 or 1 which is so minimal that children usually don't have symptoms with a level 1 allergy to dust mites. And I saw that happen with my own daughter. She was so allergic. She was developing hives and congestion. We didn't know what was going on. We did the workup. She was class 6 on the dust mites, the highest level. We did all the allergy control at home, and when we checked her blood levels a year later, she was a class 0 because we did all the dust mite control, and once we got rid of the allergen, she became better, and she pretty much recovered.
Wow, it sounds like you do a very thorough job over there. Tell me where, and the listeners, where you're located here in Boca Raton.
My office is in West Boca. I'm on West Boca Medical Center's campus. There's 3 office buildings right in front of the hospital on 441, and I'm located in the 9980 building.
Okay, and also on staff at West Boca Medical Center?
Yes, I'm on staff at the hospital.
And how long have you been practicing pediatrics in the Boca Raton community?
We've been here in town for 21 years.
Oh, wow.
Yes.
That's great. Now, we're going to take a quick break, and on the other side, we're going to talk to Dr. Ocampo about immunizations, vaccinations, and attention deficit disorder, ADD. So stay tuned on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too. We're here with Dr. Narina Ocampo. She's a pediatrician here, and she just told us she's at 9980 Central Park Boulevard North, Suite 108A, and that's here in Boca Raton. The number's 561-487-5437, and it's www.drnarinaocampo.com. So DR and then NORINAOCAMPO.com, drnarinaocampo.com. Dr. Ocampo, I want to ask you a question that's kind of been in the news since I was a kid, and I don't think before that it was that big of a topic, but attention deficit disorder, or ADD, always seems to be in the news now. What is ADD, and why is it so prevalent right now?
Well, ADD is, our diagnosis is actually ADHD, attention deficit hyperactivity disorder, and a child can have the hyperactivity with the inattentiveness or just the inattentiveness alone. And I think we've become better at diagnosing it, so we are seeing it more, but it is out there and it is real. And when children get the proper workup done, they see a psychologist and get the testing done and run through a battery of tests that are all standardized. And when these results fall within a certain range, we know that they have attention deficit disorder. And then we talk to the family about starting their child on medication. I know medication has been a big controversy, but we have so many studies that show if a child truly has it and was tested properly, when we start the medication, we can get a 93 to 95% improvement rate in these children. If therapy is done alone, maybe 3 to 5% success rate. And if you combine the two together, you're up to about 90% success rate. So we really see a real difference that the medication really works, and children do better in school. They're not getting picked on all the time. The teachers are not frustrated. Parents aren't frustrated. So it is a real thing. And initially when I first started, I thought, oh, medicine, this is terrible. We shouldn't be putting kids on these medications. But after attending many conferences and reading many articles and just seeing how these children improved over just a matter of days with starting the right medication and getting onto the right dose, teachers would even call parents and say, what happened? Why are they paying attention? Why are they not calling out in class or running around and why are they not being disruptive? So it is real and it is out there. But if you do the proper testing and you get the proper results, you can really help that child. And then they will do really well in school.
And that's important. And I also want to point out, you're involved with some teaching appointments. So you're also on the, always involved with the most recent and teaching your students, correct?
Yes.
Okay.
Yes, I'm on staff, clinical teaching staff with University of Miami's medical school and FAU's medical school.
Hey, FAU, I'm an alum. It's awesome.
Well, my daughter's an alum of University of Miami. Go
I was Miami
Hurricanes.
first. Definitely. I was the biggest Hurricanes football fan there was back in, saw the greatest football game ever, but that's a story for another show. 2000 FSU Miami. So Miami took that one at the Orange Bowl. Jeremy Shockey, 80-yard touchdown. Anyways, we'll go in there. So you big football fan?
Yes, I am.
And you watch them? Okay. And they got a new coach who
Yes.
actually met recently.
Great. Mhm.
He's from Boca Raton, Mark Richt. He went to Boca Raton High School.
That's right. I read
Seven-
that. And
yes.
then he was at Georgia, and then he
Oh, he
came-
did great at Georgia.
Yes, and now he's here.
Oh, yeah. Perfect timing, too. The program really needs him. But UM's got a ton of great programs. I was watching their men's and women's basketball this past year. I became a really big fan. I never watched UM basketball in the past. So, and their baseball team's always been great.
Baseball team's awesome. And the basketball team has gotten some recognition over the past couple of years, too.
They got a really good coach and great private school, great school altogether. I wanted to ask you also ADHD, so it's attention deficit hyperactive disorder. Thank you. That's something that can be spotted during an office visit as well?
Well, usually when the kids are younger, a lot of them do bounce off the walls. They're jumping from the table to the chair and all over the place. And sometimes when they're 3, 4, 5 years old, you might think, oh my gosh, maybe this child might be developing attention deficit disorder. But the real test is when they're in school. If they can't sit still and the teachers are complaining and then parents are complaining at home, they can't sit still, they can't do their homework, they can't follow directions, then when that concern comes up in the office visit, then we talk about getting them tested. And like I said, the psychological testing are standardized tests. We have many wonderful psychologists here in Boca who perform the testing. There's also psychiatrists and neurologists that you can refer the patients to also. And the tests, like I said, they're standardized and they can actually filter out if it's a learning disability versus attention deficit disorder, because a child with learning disability may also be disruptive. They can't learn, and you might think it's ADHD, but it's really a learning disability, and they need a different type of treatment than attention deficit disorder. So that's why the testing is really important, because it can filter out other problems.
And an office visit, you'll be able to refer them to the proper testing?
Yes.
Okay. Good to know. Let's, where did you go to medical school, Dr. Ocampo?
I went to Georgetown Medical School.
Oh, wow. Awesome. An internship?
I did a surgical internship, and I did that at Georgetown Hospital. But my husband and I didn't match together, so I gave up my surgery career, and then I switched over to pediatrics, and we both went to Medical University of South Carolina in Charleston and did our residencies there.
Let's give your husband a plug here. He's a local physician as well?
Yes, he's a plastic surgeon.
In Boca Raton?
In Boca. We share an office
Awesome.
together. He has one side, I have the other side. Completely separate, but we share an office together. So I see him every day.
That's great. And residency?
And then the residency was at Medical University of South Carolina in Charleston. And after that, I started working.
And I see you also did a fellowship there as well.
I did. I did a little bit extra in general pediatrics. I helped work at the medical student and the pediatric resident clinic. I just felt I just needed a little more experience dealing with general pediatrics. We were at a wonderful children's hospital, so we got to see all of the pediatric subspecialties, from pediatric cancer, cardiology, nephrology, cystic fibrosis, lung diseases, sickle cell disease. So that was really great. And then and even though we had rotations in our clinic, I just felt I needed a little more help and a little more experience. So I spent a year doing that. And it was only one day a week. It was my own selectively designed fellowship that the department was willing to work with me, and I worked 4 days a week at the College of Charleston at their student health service, dealing with the college kids. And so that's why I feel comfortable seeing patients till 21, because I worked with college students for a whole year.
And that's important. And not all doctors have the fellowship and extra education and training. So that's really neat. And we have a lot of New York listeners. So I got to ask you this. You're an attending pediatric physician in the Bronx, New York City hospital area?
Yes. After we left Charleston, my husband got a fellowship in plastic surgery at Yale, and I was looking for a job in the New York City, Connecticut area. And my roommate from medical school, who was also a pediatrician, she had been working at Montefiore Hospital in the Bronx. It's associated with Albert Einstein College of Medicine, and she was working in their pediatric emergency room. And she heard I was moving up, and she said, "Oh, there's openings in the pediatric emergency room." And so I interviewed, and I worked there for 2 years while my husband was doing his fellowship. And it was a great experience, but it was very difficult because it was really difficult seeing kids coming in stabbed and gunshot wounds and a lot of drugs involved. And then I decided that wasn't for me. I wanted to be more in a private practice type of setting.
Nice. And then so you've been practicing medicine in two big cities, New York City, Washington, and now down here in Boca Raton.
Yes.
Let me throw you a curveball question that I want to ask. Do you speak any foreign languages?
I speak Italian. My mom's
Awesome.
from Italy.
That's great. I'm Italian. You know my last name, DiPino. But so you actually have been to Italy numerous times.
Yes. When we were growing up, my mother and father, we would go to Italy every few years to visit all of her brothers and sisters and all of my cousins. She was the only one who came to the United States. The rest of her brothers and sisters stayed in Italy. And then with my husband and children, we had the opportunity to visit Italy when we did a Mediterranean cruise a few years ago. And now that my kids are out of the house and my husband and I are empty nesters, I did a 2 girls trip with my closest friend and roommate from medical school, and we went to Italy twice, and we went with several girlfriends and just had a great time.
That's great. And it is, if you've never visited Italy, it's probably my favorite country I've ever visited. And I was lucky enough to go when I was 12. I actually went to Milan, Pisa, Florence, and Rome.
The whole northern part, yes. Beautiful.
But I want to go back. I think my family's from a little farther south, so I have to figure that out with my ancestry tree. Let me ask you what you do outside of medicine. I know you're a very busy pediatrician. I know you came all the way from other side of West Boca there and talked to us today, and you barely got here on time because you had so many appointments and walk-ins today. And then you were telling me also that you're on call there. So what are your hobbies and passions in life outside of medicine?
So outside of medicine, I love to read. I'm in 3 book clubs, and I do a lot of reading. And I love to garden and grow orchids. I probably have close to 100 orchids in my front and backyard. So I'm constantly out watering and fertilizing every week, taking care of them. And I like to do just light exercising, bike riding, speed walking with my girlfriend, light weightlifting, things like that, just to keep me healthy and keep me going. And I love to cook. I really love to cook and have people over for dinner. So I cook a lot and love doing that.
That's great, Dr. Ocampo. Thank you so much. That 30 minutes went by so quick. I could sit here and talk to you for an hour, but let me give your info out again. And then Dr. Nerino Ocampo, general pediatrician here in Boca Raton, 9980 Central Park Boulevard North, Suite 108A. It's drnerinoocampo.com, so just put the DR and then her name in. And then numbers 561-487-5437. Dr. Ocampo, thank you again so much for coming on Doctors Are People Too.
Thank you for having me.
And we'll be right back after these messages.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red one, that light red one. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back with Doctors Are People Too here on iHeartRadio and globally on the iHeartRadio app. I'm really excited because we have Dr. Charles Harris on the line. He is assistant professor of surgery at FIU. He's a clinical professor of surgery at Nova Southeastern University. He's director of the Comprehensive Breast Institute at North Shore Medical Center in Miami, and he's chief of surgery at North Shore Medical Center in Miami. Maybe the longest resume that I've had on the show yet. Dr. Charles Harris, how are you?
I'm good. Thank you for having me here.
Yeah, and thank you for giving me all that. That was an awesome intro. I really appreciate having a lot to talk about there. Let's get right into it. Again, welcome. Let's talk about peripheral artery disease. This is something that I've heard a little bit about in the news lately, and I definitely wanted to have a vascular surgeon on to talk about. So let's just start with the basics. What is peripheral artery disease? And we're waiting to see if we may have a little bit of a connection. The phone dropped. Dr. Charles Harris will call us right back. But he is president of Dr. Charles Harris, MD and Associates. That's General Breast Vascular and Endovascular Surgery. That's at 1190 Northwest 95th Street, Suite 101 in Miami. That's the area code 33150. So it is over there right by North Shore Medical Center in Miami. His phone is 305, and it's 691-2941. And he's at drch@allsurgery.com. Dr. Charles Harris, how's the back on the line with me?
I'm back on the line. Sorry about that.
No problem. My phone's been dropping today and actually just died out of the blue, my battery. And it's a new phone, so we're going to throw it to the technology out there. But let's talk about peripheral artery disease. Just the basics first. What is it? What are the symptoms?
It's a narrowing of the arteries, usually to the legs, but also to the kidneys and even to the brain. And you get symptoms depending on which artery gets narrowed. So if you get a narrowing in the artery to the leg, then you will have pain in the leg, or you can get ulceration, or you can get gangrene. In worst case scenario, you can get amputation of the leg. If the carotid artery or the artery to the brain narrows, you can get strokes, which is a portion of the brain dying because it gets blocked off. So it can be pretty serious when it comes to the.
And
when it comes to.
Oh, go ahead, Dr. Harris. Sorry.
Yeah, when it comes to the kidneys, you can get renal failure, kidney failure, and you can end up having to be on dialysis.
Now, is this a condition that's painful, and also can it affect quality of life and even regular walking?
Yes, it's very painful when it gets more advanced. You can get somebody who normally walks a lot, and the legs, the arteries to the legs narrow. You can end up having less and less ability to walk. So the distance that you can walk is less and less because of the pain. So you will walk for a block or 2 blocks, and then because of the cramping in the legs, you end up having to stop and wait for the circulation to catch up. And then you can walk those 2 blocks again, and then you have to stop. It affects your lifestyle. When it gets even more severe, you can get pain at rest. You're sitting down, you have pain. You're lying down, you have pain. And usually brings you to the hospital, to the emergency room, to your doctor by that time. And as I said before, the worst case scenario is that you can end up having to have amputation of the legs.
And Dr. Charles Harris is the chief of surgery at North Shore Medical Center in Miami. That's right off 95 there on 95th Street. You can't miss it. I think it's only like a mile from 95. I've been there a few times. Easy to get in and out of. A lot of parking. So if someone, you or a family member, has something that's ailing you, you may want to look Dr. Charles Harris up. You can call him at 305-691-2941. Dr. Charles Harris, peripheral artery disease. What age of the population are affected by this condition?
Well, the classical answer to that is that older folks, it used to be past 60, past 70 years of age, but now I'm seeing people in their 50s and even in their 40s having peripheral artery disease. I've done surgery on patients that are in their 30s, even 37 years old. And usually it's patients that have risk factors such as heavy smoking for many years, diabetes, high blood pressure. So those factors predispose you to having it at a younger age. But the general age range is 50 and above.
Okay, and then you mentioned surgery, and I think as common folks, we all kind of think, oh, surgery, but nowadays it's very minimally invasive. I know all the hospitals are doing their best to, make this easy on the patient because in the end, if there's less infection, there's less complications, etc. So let's talk a little bit about this type of surgery. You're a vascular surgeon, so how do you treat peripheral artery disease?
Well, historically, you had to do major surgical bypasses where you have to open up the abdomen or open up the legs and attach bypass grafts to bypass the blocked area. Nowadays, more than 90% of the time, we use minimal invasive techniques where we use needles and wires to go into the artery and thread wires past the blockages and then balloon the blockages open. Sometimes we put stents to keep them open. Well, different devices, something like drills and rotors, to pass through these blocked areas and open them up. So we're very, very successful at opening up these areas now. The benefit is that you can go in with a little needle. You have little to no scarring. Sometimes when I see a patient afterwards, I can't even find where I went in because the scar is so small. And the patient, which normally would have stayed in the hospital a week, goes home the same day sometimes, many times. Most of the procedures, when they come in the morning, they have the procedure, they rest an hour, then they go home, rest that day, the next day they're up and walking again. So the minimally invasive techniques are so much better than the open techniques now.
Go ahead, sorry.
I'm not sure. We recently opened a brand new hybrid operating suite, which I believe is the first or one of the first in Miami-Dade County, where we have all of the minimally invasive techniques and the best X-ray equipment right there in the operating room. So we can do the minimally invasive, and we can also switch and do the open, or we can do hybrid, meaning a mixture of minimally invasive and open procedures for the convenience of the patient. So instead of do one part in one part of the hospital and then go into another part of the hospital or even another facility altogether. We do everything in the operating room at North Shore. And that's a huge leap forward in terms of benefit to the patient.
That definitely is. I mean, not having to move the patient around, like we said before, can obviously lessen any complications when you have a doctor this magnitude in just one spot with his team and can do everything right then and there. That is so important, and that's done at North Shore Medical Center. They're treating peripheral artery disease, or as they say in the media, PAD. And I was doing my research, Dr. Charles Harris, and I couldn't believe that more than 8 million cases a year, and I may even be off because that number is probably growing. Can PAD be mistaked as arthritis, like pain in the leg kind of when we get older?
Absolutely. I would say that maybe a third of the patients that come have arthritis as well, or only arthritis. So that's an excellent question. I've become a little bit of an expert in arthritis as a result of being a vascular surgeon, because we get so many patients with arthritis. So we work with the orthopedic surgeons. I send patients on to the orthopedic surgeons. Sometimes we send them on to the rheumatologist after we determine that it's not a vascular problem. So yes, absolutely. Patients come and they think that they have PAD. They hear about it in the news and they hear about it in programs like this. And they figure that they need to get checked out, and we check them out. And then we find that, hey, your pulses are fine, your circulation is great, you have arthritis.
And it sounds like Dr. Charles Harris has an unbelievable team there at North Shore Medical Center, and his referring physicians. He just talked about an orthopedic surgeon, rheumatologist. So that is great to hear. We have about 1 more minute till our first break, and I want to keep Dr. Charles Harris on the line because I want to talk to him about as much as I can ask him in these 30 minutes. So is the peripheral artery disease, Dr. Charles Harris, is it more common in men or women?
It's about equally distributed, and it depends on the region. It depends on the profile of the community that you're living in. So if you have a community where the men are obese and smoke a lot, while the women don't, then it tends to be a little bit more predominant in the men, and vice versa. And you have another community where there's a lot of diabetic women, and then you find that the women have a little bit of a higher incidence of PAD. But it occurs in both. In men, the PAD can affect erectile dysfunction and ability to perform. So we're addressing that as well in our treatment for PAD.
That's good. Go ahead.
The presentation varies depending on which part of the body that's affected, as I said earlier.
Okay, we're going to take a quick break, but we have Dr. Charles Harris on the line. He's he's actually chief of surgery at North Shore Medical Center in Miami. I believe the website is northshoremedicalctr.com, and the number, he's got an office also in Miami, 305-691-2941. We're going to take a quick break, and on the other side, talk to Dr. Charles Harris about a little bit what he does with general breast and endovascular surgery. So stay tuned, and we'll see you on the other side.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Chance, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which which involves trying to convert the patient back to a normal rhythm if they have an arrhythmia. Also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff. We're very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too with Dr. Charles Harris. So it's Charles and then dash Harris, common spelling. So that's his last name. And I just want to make that clear because I don't want anyone to get confused. Dr. Charles Harris is director of the Comprehensive Breast Institute at North Shore Medical Center in Miami, and we're going to talk a little bit about that in a second. And he's also chief of surgery at North Shore Medical Center in Miami. Again, his office number is 305-691-2941, and North Shore Medical Center is right off 95 95th Street, exit there in North Miami area. It's 1190 Northwest 95th Street. Dr. Charles Harris, one more question about peripheral artery disease, and I'm going to change the topic a bit. But I wanted to ask you, how did you become an expert on this subject, and did you have to go through education and training to perform these? I know training for the surgeries, but education and training to perform these treatments?
Yes, absolutely. When I was in a residency, surgical residency, I spent extra time in vascular surgery. At that time, we did not do that much in the vascular. So once I started practice, I went on multiple courses in different hospitals and under different experts. And I also went and did additional qualifications, becoming more certified in endovascular medicine as well. So you escalate your knowledge and your repertoire of what you can do, and increase the range of what you can do to treat your community. And that's what I did.
And obviously you're still teaching today. I mean, you're teaching MD students, so as an assistant professor of surgery at FIU and clinical professor of surgery at Nova Southeastern University. So you're always in tune to the latest and most recent studies and education and training, correct?
Correct. I believe that us professionals should stay current, and because you have programs like yours that educate the public, and then the patient will come to me and they will ask me questions, and if I don't read and keep up and listen to your program, for instance, then I'm going to be thrown a curveball. Also, in order to give the best care to the community, we need to know the latest. Sometimes the latest is not the best. Sometimes what's marketed is not right. And I need to know what is being told to people so that I can do the best for my community.
Well, Dr. Charles Harris, thank you so much for the kind words on the show. I do appreciate it. And, it is our goal to, let the community know about the latest and greatest in healthcare. And also, if they ever want to ask a question, we have a toll-free number, 1-888-565-1470. So thanks again. But let me change gears here because you are also a general surgeon and vascular surgeon and endovascular surgeon. So let's start with general surgery. What kinds of things are you helping the general population, get healthier with? What kinds of treatments in general surgery?
On the general surgery side, we take care of multitudes of different problems, as simple as little lumps and bumps to large tumors of the breast, cancers of the breast, cancers of the colon. We do minimal invasive colon surgery as well as open colon surgery, removing the cancerous tumor so that it can't spread. And we also take care of things like hernias, hernias in the groin, hernias in the abdomen. And again, we do both laparoscopic or minimal invasive and open surgery for these. North Shore is getting the robotic system, Da Vinci, by the end of this month. And we will be expanding into robotic surgery in these areas as well as in many other areas as well.
Wow, so robotic surgery. That's so futuristic it sounds, but it, like you said, it's very minimally invasive.
Right. It's minimally invasive and it has certain advantages in that the recovery from surgery is much faster, the pain is much less, the scarring is much less. So as part of being able to offer the best to the community, North Shore Medical Center thought that they would be able to offer this robotic surgery as well.
And when I was doing my research to have you on, I just Dr. Charles Harris, if you plug that in Google, you're going to come up with a ton of information. I one page it must have been like 1,000 words, so it's very informative. Now, did you start the director or Comprehensive Breast Institute at North Shore Medical Center as well?
Yes. When I started working at in the North Miami area and North Shore, I realized that there was a very high incidence of more advanced breast cancer than in the general population in the United States. So in the general population, the incidence of advanced breast cancer is between 30 to 35%. But in the North Miami area around North Shore, it was between 45 to 55% of advanced big, tumorous breast cancers. While at the same time you have a very gainfully employed and many times professional population. So I thought that we should offer the latest equipment, the latest training, comprehensive staff in order to treat and try to address this terrible statistics. So I approached the administrator, the CEO, Mr. Manuel Linares, and he immediately recognized the benefit to the community of what I was saying. And in less than 6 months, it went from zero to built. And we got all the equipment, and we have been making a huge difference in the Comprehensive Breast Institute at North Shore ever since.
And that's northshoremedicalctr.com. Just plug that into your browser. We're here with Dr. Charles Harris. He's director of the Comprehensive Breast Institute at North Shore Medical Center and also chief of surgery at North Shore Medical Center. So we've hit on a lot of things already, doctor. So we've talked about peripheral arterial disease. I think you answered like a dozen questions of mine on that. I became fascinated in that topic as I started doing research on it. And then also you told us all the things, treatments available at North Shore Medical Center for general surgery and endovascular surgery. Let's talk a little bit about you. We have a couple more minutes. Where did you go to medical school, your education and training? And lastly, why did you get into medicine?
Well, I'll start with the last question first. My dad is a doctor. My uncle is a doctor. My mom is a nurse and a nurse educator. My sister is a nurse. My aunt is a nurse. I have quite a few medical people in the family, so it was a natural progression to become a doctor. I also grew up in the beautiful island of Jamaica, where the access to healthcare wasn't as easy as it has become now, and certainly not to the level of the United States. So I thought I could make a difference when I went to medical school. So I went to medical school in Jamaica. It was an excellent grounded training in clinical aspects of medicine, physical diagnosis, taking history, and really seeing a variety of especially tropical diseases. And then after that, I came to New York, Mount Sinai Medical School in New York, and did my surgical residency there. And that was an awesome experience. It was incredibly busy. We were doing more than 100 surgeries of all varieties every day at Mount Sinai in New York. And of course, as a surgical resident in training, you are assigned to certain types of cases that you need to get experience in. And but the requirement might be 3 of a particular case or 10, and we could probably triple or quadruple the amount of experience because of the high volume and the expertise at Mount Sinai in New York.
And Dr. Charles Harris, I hear the music playing, so we have about 30 seconds. Did you you've been watching the Olympics? So were you excited last night with Jamaica?
Usain Bolt, yes, and there's more to come.
The lightning bolt. You heard it here first with Dr. Charles Harris. Hey, Dr. Charles Harris, thank you so much for coming on the show. I have to have you on again because we could talk for hours.
I'm happy to be here. Thank you very much for having me.
All righty, there's Doctors Are People too. Stay tuned next week.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.